Hi everyone, I'm Mary with Mary Greeley News. Thank you for joining me. Those of you that follow me on Twitter know that I've been following what's going on with the Ebola outbreak in the Republic of Congo and the Republic of Guinea. There was a rumor that was posted, I don't know if it's true or not, about a patient being brought in from Africa to New York City for treatment for Ebola. Well, yesterday, Wednesday, March 24th, I had an appointment in Sioux Falls, South Dakota, for a doctor's appointment at the major hospital there. And amongst the questions of the typical COVID virus, they asked me if I had traveled out of the country within the last 20 days. When I got to the waiting room, waiting for the doctor to come in, they asked me the same question, and yeah, my little antennas perked up. I knew right away that it was Ebola. And I asked the nurse about the Ebola outbreak. I had heard a rumor that a patient from Africa was brought to New York City for treatment for Ebola. I asked her if she had heard about this, and she told me she did. I posted on Twitter a question that if people started dying here in the United States from Ebola, did they think that the U.S. would cover it up, saying it was a COVID death? And the majority of the people all said that they thought the U.S. government would do a cover-up. Ebola, or actually any virus, can travel around the world within just 24 hours, according to the CDC. At the end of last month, the CDC, the United States government, set up 6 different airports to monitor people coming in from the Democratic Republic of Congo and Guinea. Chicago O'Hare Airport is one of those places where they take their temperature, ask them for contact information, of course ask them if they come in contact with anybody they knew for a fact had Ebola or anybody that had died. So I was rather shocked that South Dakota, the hospital, asked me if, I had come in contact with anybody that had Ebola, if I had traveled out of the country, seeing how South Dakota is one of the smallest populations in the United States. Now, Sioux Falls is one of the major cities we do have here in the U.S. I don't think any of the smaller towns are asking any questions about being exposed to Ebola. And I recently discovered how there's 2 groups of people who have traveled to that area that the United States government is going to be monitoring. This is not being covered by mainstream media. One of the group is 44 people who recently traveled to one of those 2 countries. 44 people. On the Herald Leader, they had an article posted on the 17th where 11 residents from Kentucky were being monitored. MSN had it buried, this article, under lifestyle. The governor of Kentucky said that they had 6 hospitals in the state ready for any suspected outbreak, any patient of Ebola. Only 6 hospitals. They claim in this article that Ebola is not airborne. Well, that's a bunch of hogwash. If you cough, the particles go out into the air. They're suspended just like COVID. There was another Twitter post saying, are you going to mention the 44 refugees that were exposed to Ebola in Africa and who were flown into the USA, now in Ohio and Kentucky? One would think that would be a major story. Yeah, and it is a major story, and they're not covering it. Here's a Twitter post from the 23rd. Kentucky is monitoring 11 people who just got back from high-risk areas in Africa for Ebola. Now, this reemergence of the Ebola virus is because it was spread by people, or a person, who had contracted the virus back in 2014, and it was still active in their system, either in their eyes, yeah, it can settle in your eyes, or in their sperm. It is the same virus from 7 years ago as was in 2014. 7 years ago, that virus laid in someone's system and they're spreading it or spread it. One of the first people in Guinea that died was a nurse who treated another patient. They don't know if she caught the virus from that patient that she treated or if in fact she had it dormant. Can't really say dormant, but it was still in her system. That nurse died on January 28th. This article states that the White House announced on February 16th officials were working with leaders in Guinea, the Democratic Republic of Congo, Sierra Leone, and Liberia to limit the spread to neighboring countries. People who are infected have experienced severe fever, vomiting, hemorrhagic bleeding, bruising, diarrhea, and fatigue. The later stages of infection, skin rash, red eyes, and hiccups can also occur. This Twitter post says, not front page news, but for those of us involved in the 2014 and 15 response work, this is really stunning. Genetic sequencing of the virus samples from the patient in Guinea suggests that the new outbreak is a continuation of the 2014 and 16 epidemic. That was on the New York Times, evidently. This Twitter post from the 24th of this month says, in Kentucky too, apparently. They think the current Guinea Ebola outbreak started from a man who had it dormant in his system for years after having it for years ago, and they used to think that it was only in their system for 500 days. There's a lot about this virus they don't know. And it could be up to a 90% death rate. The CDC has a page stating that on March 2nd, requirements for airlines to collect designated information for passengers destined for the United States who are departing for or were otherwise present in the Democratic Republic of the Congo or the Republic of Guinea. So here we got South Dakota asking questions. Were people missed that came in from those areas? Or is this precautionary, what they're doing here in South Dakota? Yeah, they didn't do very good in keeping the COVID virus from spreading around the world. The only masks that can help prevent you from getting either COVID or Ebola is actually the N95 mask. The hospital little paper mask, those don't work. Anybody can have this virus and not show any symptoms. They can still be shedding the virus. The people returning are not put into quarantine. All they do is collect their name, address, contact information, emergency number information, etc., and they're sent on their way. They ask people with symptoms to self-isolate. They ask them to do it. It's not required, not mandatory. They're only asking them to self-quarantine. The last time this happened, the screening was done at JFK International Airport, Washington Dulles, Newark, Chicago O'Hare, and Atlanta International Airport. And you'll remember how at least one man slipped through the system. Where was it? Texas he ended up in, and then exposed a nurse there who caught Ebola. And just think, they probably still have the virus. They could still be spreading it after all those years. In Ohio, they have a bill that says handcuffs Ohio's ability to confront the crisis. SB 22 strips local health departments and Ohio Department of Health of their ability to protect Ohio citizens from these possible future threats. The bill prohibits a local health department and ODH from requiring someone to quarantine or isolate unless there has been a specific medical diagnosis of that person or unless that person has come in direct contact with someone who has been medically diagnosed, and then they give some examples. The governor of Ohio did not say when the group had traveled or returned to Ohio. Bill 22 would go into effect in June. Now here's a Twitter post saying that it was passed 19 hours ago on June 24th. overriding Governor Mike DeWine's veto. Yeah, if you think about COVID as a trial run for taking care, stemming the spread of a pandemic, well, they did a very poor job on that. So what are your thoughts? Please put your comments down below. Thank you for watching. Please stay safe, and I'll talk to you later. God bless you.